Now let's move on to look into the mechanism of blood clotting. And first we are to look at the significance of it. So first is to prevent excessive blood loss when there is injury or damage to the blood vessels. And number two is that we want to prevent the blood pressure from dropping to a very low level, because pressure is the one needed to maintain a proper blood circulation. And number three is that the blood clot will seal a wound and hence preventing the entry of microorganisms into our body. So this is the mechanism of blood clotting. So first, the coagulated platelets with the damaged cells, the clotting factors in the blood plasma will form an activator, and that is the thrombokinase. So with the help of calcium ions and vitamin K, will then convert prothrombin to thrombin. Okay, this enables this thrombin to catalyze the conversion of fibrinogen to fibrin, which is insoluble. So fibrin is like a network of protein fiber that forms a network on the wound surface that will trap the erythrocytes to close the wound and hence preventing blood loss. Now this is the steps or the mechanisms of the blood clotting mechanism. Right, so these are the stages, the summary in blood clotting. Okay, vitamin K. Have you ever heard that vitamin K is very essential in the blood clotting mechanism? Now, this is the reason why. Because the formation of this prothrombin in the liver requires vitamin K. Okay, now let's look at the issues related to blood clotting. Okay, the first one is hemophilia. Okay, hemophilia is an example of illness that prevents blood from clotting. Okay, this is very dangerous. Okay, when there is a cut or a wound and when our blood is unable to clot, what will happen? This will cause excessive bleeding, even due to small wounds, and eventually lead to death because our blood fails to clot. Okay, hemophilia is a hereditary illness and it is caused by lack of certain clotting factors. Because can you remember just now when we talk about this, the series of reactions, a lot of reactions which is involved in the blood clotting mechanism? Okay, all these clotting factors are needed. But then, what happens if these clotting factors are absent? So surely blood clotting cannot happen. Now, hemophilia is because of the lack of gene that produce certain clotting factors such as factor 8, and it will cause this impaired clotting mechanism. Hence, serious bleeding happens. Okay, particularly in the joints. And this hemophiliacs is the one that have this disease, hemophilia. So these hemophiliacs may die of internal or external bleeding. Okay, but nowadays there are some treatment, okay, to curb this problem. Okay, the second issue is thrombosis. Because of the formation of this blood clot, and we call it as the thrombus. So it happens as a result of damage in the blood vessels or the sluggish blood flow. Sluggish means slow, and that causes the clotting factors to accumulate, and therefore a blood clot is being formed. Okay, then embolism is another health issue related to blood clotting mechanism. Just now we said this thrombus is being formed, and when this thrombus is transported by a blood flow, Now we no longer call it as thrombus, but it is now a traveling thrombus known as embolus. And if embolus gets stuck in tiny blood vessels, then this is very dangerous because it will stop the blood from flowing. Okay, so when you sit for too long, the risk of thrombosis in legs will increase. Okay, so you may want to move your legs once in a while, right, to prevent this formation of blood clot known as thrombus. Okay, so this is thrombosis, a condition of the blockage of the artery. And when this thrombus dislodged is carried away by blood circulation, now we call it as embolus. But when it gets trapped in small artery, here is the danger because it's going to block the blood flow. Okay, and it depends. For example, if it is blocking the coronary artery, then it will cause chest pain. But if total blockage, coronary artery is the artery that is supplying the hearts with this blood, with oxygen, with nutrients. So imagine if there is total blockage, what will happen? The heart muscles will die because there is no oxygen, no nutrients, and we call that as the heart attack or myocardial infarction. Infarct means die. So the affected muscles are damaged. If only small areas of muscles die, victim still have the chance to recover. But if it is extensive heart muscles damaged, this will lead to death. Okay, what is stroke? Stroke occurs if there is blockage of blood to the brain cells. And it is commonly caused by the embolus blocking the flow of the blood to a portion of the brain. Okay,